Another topic here related to, sort of related to this, is Minnesota's engaged in another funding fight with the federal government, this time involving healthcare and grants specifically from the Centers for Disease Control. The CDC announcing the cancellation of about $600 million in total in grants to 4 states. Now, these are grants that go out nationwide, but in this case, 4 states targeted with these cancellations: Minnesota, along with California, Colorado, and Illinois. And the reason they gave is inconsistent with agency priorities. Now, yesterday, a federal judge issued a temporary restraining order to pause these cuts after these 4 states, including Minnesota, sued to do so. Joining me now is the Deputy Commissioner of the Minnesota Department of Health, Wendy Underwood. Wendy, thanks for taking some time here today. First of all, describe, again, these are CDC grants. Describe what they are and how much money this has either come to Minnesota or is expected to come to Minnesota under these grants.
Thank you so much, Rob. We really appreciate the time. So yesterday morning, we did receive confirmation that the federal government is canceling until overnight roughly $38 million in Minnesota. And as you noted, we were one of 4 states that received this cancellation. Now, this funding was provided to all 50 states in the wake of COVID-19 to specifically build, as the CDC says, a stronger, more resilient public health system that is ready to face future health threats. It was established in 2022, with a clear end date of November 2027, and includes extensive agreements and work plans between states and the federal government. Those funds to build modern and strong public health infrastructure. And by this, I mean providing local communities all across Minnesota funds and resources to really strengthen their ability to respond to public health crises by having things like modern emergency preparedness plans in place, ensuring good access to modern data and information, having communications systems in place, and ensuring staff and community members can get good ongoing training. We know from COVID that there is no time to learn how to respond to a crisis. You have to already know, and you have to have plans in place so that you can act as quickly and as smart as possible, because it's about saving lives.
What is your understanding here, of when the CDC says the priorities have changed? I know I read through some of their descriptions here online, and some of this is, because of DEI-related programs. Some of it is some other things. What are the priorities that have changed, that have impacted the grants coming, that are supposed to come and have come to Minnesota?
Yeah, Rob, that's a great question, because we completely don't know, because emergency preparedness is for all people, for all Minnesotans, and all across the state, particularly in our small rural areas where they don't have staff and infrastructure on their own to be able to build out and provide these things without this extra support provided by the federal government. But, because it is just the 4 states who targeted at the cancel of the fund, it is really questionable, and it is putting the lives of all people at risk. Should we have
we're having a little bit of trouble hearing you here with our Zoom connection. We apologize to the viewers for that. But what is next in this? I mean, obviously there's a temporary restraining order to pause these cuts from the CDC. Where do you see, this going, and are there potentially more cuts looming for Minnesota's health department?
Sure. Yeah, we are very fortunate that Attorney General Ellison was able to quickly work with the 3 other states to file an impeachment. And so to get that temporary restraining order and buys us a little bit of time. But it is all very disruptive, our work, and to the plans in place across Minnesota. And I know you alluded to it, that while we were, had heard about this potential, we heard about potential for more cuts to 3 additional critical programs. And so this ongoing disruption and unnecessary chaos that really puts public health in Minnesota to risk.
Okay. All right. Well, thanks for taking some time with us today as you know, you continue to grapple with, you know, again, federal funding cuts, specifically these grants from the Centers for Disease Control. And then, of course, a court battle here as Attorney General Ellison and the AGs from these 3 other states have sued and won a temporary restraining order. We'll keep tabs on this. Appreciate you joining us.
Thank you so much.
Okay. All right. There we go. That is the Deputy Commissioner of the Minnesota Department of Health talking about, again, a pause or a cancellation of CDC grants to Minnesota and 3 other states here that the Minnesota Health Department describes as a continued retribution and targeting of Minnesota and other Democrat-led states.